and welcome to another episode of Let's Talk About It. I'm Dr. Whitley Lassen, and I'm so excited to be joined today by Dr. Elizabeth McMahon. Dr. McMahon is a licensed clinical psychologist. She's an expert in anxiety, and she has a private practice in San Francisco where she treats clients who are dealing with anxiety problems. She's also the author of Overcoming Anxiety and Panic Interactive Guide. Welcome back, Dr. McMahon.
Thank you, Dr. Lassen.
Today, we're going to talk about how to overcome OCD. Dr. McMahon and I have already talked about what OCD is and what it's like to live with OCD. To learn more about those topics, check the links to those videos in our description box. So, Dr. McMahon, we've talked before about how OCD is a mental health disorder. Can you talk a little bit about the importance of recognizing it as such?
Sometimes people think of OCD as kind of a quirk, and they'll say things like, oh, I'm so OCD, just because they like things neater than perhaps their roommate. But actual OCD is a serious problem. The thoughts that come to your mind are unwanted and distressing, and the actions that they make you feel you have to take, the compulsions, can take up hours out of your day and can interfere with relationships. And those actions are a response to fear. They're not a choice. It's interesting, if you saw the first video, you may remember that scan of brain activity that showed that there are areas of the brain that are overactive. And this can start early in childhood and adolescence. In fact, 80% of people with OCD have their first symptoms as a child or a teenager. So OCD is not a choice or a preference. It's not the same thing as wanting to dust once a week when your roommate wants to dust once a year. It's not something that you have freely chosen. But recognizing OCD is the first step toward getting effective treatment.
What kind of treatments are effective for OCD?
The most effective treatment is a form of cognitive behavioral therapy called exposure and response prevention. For people who carry out this treatment, who fully comply with it, 75 to 85% of these people get up to 50% to 100% of symptom relief. This is more than can be achieved by medication alone, although medication can help you carry out the exposure and response prevention treatment. There are years of research supporting its effectiveness, and even if it's not completely cured, OCD can get so much better.
Can you explain a little bit more about exposure and response prevention?
Absolutely. The exposure piece means not avoiding situations that trigger your obsessive thoughts, that trigger your distress. And the response prevention means not acting on the thoughts, not acting on the discomfort, not carrying out your compulsions. This can be hard, as you can understand. So you want to know that OCD is a misfiring in the brain and remind yourself that your brain is stuck sending you a false alarm. So that your job is to accept that false alarm, like listening to a car alarm that's stuck outside, but at the same time, ignore it. It's a stuck false alarm. The good news is exposure and response prevention, not avoiding and not carrying out the compulsions, helps reset the brain levels back to normal levels. The bad news is you have to stop acting and doing your compulsive actions while the obsessions are still present and distressing, and it takes some time for the brain activity to resume its normal level.
What does that actually look like? Can you give us an example of exposure and response prevention?
I'd be happy to. That's a great question. So, for example, someone who's been washing their hands 10 or 15 or 20 times before dinner would wash their hands once and then stop, even if they feel like the hands are dirty or have germs on them. Someone who has OCD where everything has to be perfectly put in a rigid order would need to allow objects to be put away without being perfectly ordered, without being perfectly lined up. You'd have to understand that the thoughts and the images that come into your mind, although distressing, are not actually dangerous and do not mean that you will act on them. So, for example, someone with OCD where they have thoughts and images of harming loved ones, say through picking up a knife and stabbing someone, would have to understand that they're not violent, they're not going to act on these thoughts, and they'd have to continue to use knives appropriately. Checking locks once and then not going back. Checking the oven once or the garage door once and then not going back, not calling someone else to check, not mentally going over in your mind and reassuring yourself that you have checked. Other therapy approaches may also be helpful. Some of these may include acceptance and commitment therapy, family therapy, and mindfulness-based cognitive therapy, in addition to exposure and response prevention. I mentioned medication earlier, and the medication that's most commonly used in treating OCD is the family of medicines known as selective serotonin reuptake inhibitors, or SSRIs. These are often well tolerated and helpful, especially when combined with exposure and response prevention. Medication can make it possible for someone to engage in the treatment, but medication alone tends to provide less symptom relief to fewer people and leaves a chance of relapse when the medications are stopped. You may have also heard about forms of brain stimulation for OCD, and the research there is in the relatively early stages with some inconclusive studies. But what's exciting is that when OCD is treated, either with exposure and response prevention or with medication or with a combination, you can see in this brain scan that areas that used to be overly bright have now come back down to normal levels of activity.
Dr. McMahon, thank you for explaining how exposure and response prevention works. Can any therapist treat OCD?
Well, not all therapists are equal when it comes to OCD. If you have OCD and you're looking for a therapist, my recommendation would be to find someone with experience both diagnosing and treating it. The research shows that even with therapists who are providing exposure and response prevention treatment, that therapists who have experience treating OCD have the best results, particularly therapists who are very good at creating what's called a therapeutic alliance, who are both empathic but also willing to push you because the treatment can be hard. Successful therapists are respectful, they're understanding, they're interested, and they're challenging. The research shows that people with OCD in treatment don't get as good results with therapists who are just neutral or permissive, or with therapists who are cold or unempathic, which makes sense.
What doesn't work for OCD?
Just trying to relax, general anxiety and stress reduction is always helpful, but not an effective treatment specifically for OCD. And another thing that doesn't work is trying to stop the obsessions. We don't control these thoughts coming into our minds. The one use for what's called thought stopping is to stop if you have mental compulsions in response to the obsessions, stopping those. Because remember, the best treatment is exposure to the obsession, but response prevention, preventing the compulsive action. So stopping a mental compulsion, that's useful.
Some people might find it tough or scary to share about their experience with OCD, but we know that social support is helpful in coping with any kind of mental illness. How can someone talk about OCD in a way that will help them get support?
You might want to tell people that you trust that certain things make you very anxious, and that as a result, you feel the need to do things repeatedly or in a certain way, or things that don't make logical sense. If you're seeing a therapist and engaging in exposure and response prevention treatment, I would encourage you to explain that treatment to the people around you and ask friends and family for support in carrying out the treatment, because it's hard when you get anxious. Tell others what they can say that might help you when you're anxious. For example, some people with OCD have found it helpful if their friends or family members say, "You're looking very anxious right now. Is this your OCD? What is your OCD saying? And what are you supposed to do to make OCD better?" Or, "How can I help you not do your compulsion, but to do something else?" Offering kindness and encouragement, supportive encouragement, can also help. Friends and family may want to say something like, "I'm sorry this is hard. I care for you and I want you to feel better. I believe you can conquer OCD. What can I do to help you?"
Thank you, Dr. McMahon. I'm so glad to hear that there are evidence-based treatments that work in treating OCD. For more resources on OCD, visit the International OCD Foundation Find Help website or check out these books: Overcoming Unwanted Intrusive Thoughts, Stop Obsessing, and the OCD Workbook. For more resources from Dr. McMahon on anxiety disorders, visit her website. Be sure to subscribe, follow us on social media, and visit our website for more information about our Mental Health Ally certification and our CBT courses for mental health providers. Leave us comments and questions and suggestions on what you'd like to learn more about. Thank you, Dr. McMahon, for joining us again today and teaching us about treatment for OCD.
Thank you, Dr. Lassen, for having me. It's so important to know about anxiety disorders because there is effective treatment. There is hope.